thyroidectomy, maybe. I'm not sure if I'm saying it right.
Okay,
Thyroidectomy,
what kind of procedure is a thyroidectomy?
it's a surgery to cut completely the thyroid gland.
Okay, yeah, it's okay then.
Thyroidectomy, I think is. So we described him that we have to take him all the lymphoid glands uh, of the neck. So it will be a really dangerous procedure. And after that, he has to have the chemotherapy. So it will be at least 3 months of chemo,
Mhm.
and the patient will be has to be really strong because it will make him very sick. He won't tolerate foods, but if he is strong, he will keep on his life. In 6 months, he will recover normality, maybe.
Okay.
Yeah. Uh, it's pretty much that. So if there's always a risk that even if we do the thyroidectomy, we will have metastasis in another organ. But we are trying to fix that with the chemotherapy. He has to come 3 weeks in the row every month to the chemo. Yeah, that will be pretty much all the treatment. Obviously, he has to go to the psychiatry consultory that most oncology institutes has. So it wouldn't be. It will be a team. How we call a health health team.
Do you hear?
Yes, I hear you. It is cutting. I don't receive the video sometimes.
Healthy, with so much health.
Yeah, I'm. I think the internet is bad. I I think I'm late. I'm not
Yeah,
sure.
a little bit, but don't worry, we're gonna fix it out in the road, okay?
Okay, and maybe that's pretty much. But it's complicated because I wouldn't do that because that's the job of the oncologist. But I was there when they gave them the notice sometimes on my institute.
Okay, so don't worry. But one thing I want to know is I thought that the first thing you have to do when you have cancer, it was to do a chemotherapy. And then you can do, I don't know, you can get a surgery. But you tell me that is on the other side, right?
Yes,
First surgery and then chemotherapy.
it depends of the cancer.
Why?
Not all cancers are equal. The thyroid cancer, it's one that's evolution is really fast, so we cannot risk their health. So we go first for surgery, and then we go. It's almost the same with gastrical cancer types because they advance very fast. So we don't risk them. We prepare surgery first. But when we talk in another type of cancer that like uterus, cervical womb um, cancer, it it takes like 2 years to advance completely. So you have the time to make a chemotherapy first and go slowly. But with this type of cancer, we do it surgery first. It depends.
Okay,
Mhm.
totally complain.
Yeah.
Okay, so let's talk about something that I think you have more experience in. Okay, um, what do you think? What is the oldest and the youngest age for giving a birth that you have known for a woman?
Well, here in Bolivia, I had 13 years old, the youngest one, and
13.
yeah, yes, and they come like at 15 years for their second child, so it's normal here in rural areas especially. And my
Mhm.
oldest woman was from 42 years. I no
2,
48. Yeah, it was her.
48.
Yeah, she had 11 children, so they don't use any type of anti. I forgot the word anti. They don't
Yeah.
have. They don't use
o- Okay.
conception things. Yes.
Okay. So 48, it's like pretty much 50 years old.
Yeah, and they have the
I'm
risk.
surprised.
Their babies will have like a trisomy, or maybe because they are older in the in the I don't know how to say ovulo
Ovule.
ovule. We born with certain with a like a determinate quantity of ovulus, and with the time we go to radiation places. We are exposed to many illnesses, infections, and we can, I don't know how to say it, we transform our ovulus, and they aren't good when we are older because it's too much time. So it's not a good thing when they have too old a baby.
Okay. So the correct word should be ovum. And ovule is like ovular.
Ah,
Okay.
ovum. Yeah.
Yeah.
So that's why we prefer not to have babies before after the 40 years because it's not safely for the child or the woman.
Or the mom.
Yeah.
Okay. Okay. I totally understand. Well, I have another question for
Okay.
you. Should assisted conception be available for anyone who wants it? If not, do you think the limits should be?
Well, if anti-conception is available,
Yeah,
yes.
assisted conception. I think it refers to something induced that it should be for everyone, not only the one who have a lot of money to pay for.
Okay. Oh, assisted conception. Okay. Well, uh, it's a hard topic because if someone doesn't have the money to have a baby, how they will have the resources to maintain all all the period of life? So maybe it's a way to see that a life isn't just a game. You have to have the everything planified. I think it's a good way to say if you want a baby, you have to work for it. I agree with We maybe not that amount of money because it's really expensive, but
Mhm.
maybe something like that is hard to get, but it will worth it. I think
Yeah.
so. Yeah, I think it's a good. I think we have to change it, but not too much.
Okay. I agree with you when you say that if the mother hasn't have the the sources, right? So what should she will do with the baby? So it's
Exactly.
so difficult. Okay, but I understand. Okay, so the last one. Okay, in this time of COVID
Okay.
pandemia, what about the COVID patients? What should be the management?
What? Well, like everything, it depends. If they have a mild type of COVID, they just go home, they take their vitamins, they eat well, especially vitamin D, that decrease the probability of severity of COVID and mortality. And they will go well.
Mhm.
If they have moderate with this dyspnea, we treat them just with oxygen. But if they are in the severe type, they have to be in the um, well, why I forgot how to say the terapia intensiva. Therapy. I forgot the name. Therapy intensive. I don't know. They have to be maybe intubated.
Therapy.
Intensive therapy. Yes. Well, it depends of the stage of the COVID, or if they have any risk, like diabetes or um, how we say hypertension. Um,
Hypertensive patient.
yes, hypertensive patients. Yeah.
Okay. So thank you very much, Carla. I will send to you my little questionnaire, please,
Okay.
and I will take a picture of you, and we will say hello immediately to Liz. Okay, thank you very much. See you
Thank you.
tomorrow
See,
then.
see you tomorrow. Goodbye. Goodbye, Liz.
Bye bye.
Bye. Hi,
Hey
Andres.
Liz, how are you? Good afternoon.
Hi, teacher. Good afternoon.
How is everything? Is it okay?
Yes, teacher. It's okay. It's raining a lot of.
Yeah, here
Yeah,
too. Yeah, and Carla told me that in Cochabamba it's raining too, so I don't know.
really? Yeah, the sky is falling.
Yeah, the whole planet. Okay. So let's start. I will put you in a situation where you have to imagine that you have a patient with cancer. Okay, how
Hmm.
would you explain to him about his condition?
Benign or
Any,
not?
any kind of cancer you want. So I
Okay.
don't know what would be the management, and you can tell him. I know
Okay.
that it's not your the thing you know the most about, but you can imagine. Okay.
Okay. Well, dear patient, um, before all the, no, after all the exams that I made to you, we found some numbers that made me think that maybe you could have a condition. Um, it could be cancer. You could have a tumor. We have to do more exams to know if it's benign or not. But don't worry. I think you are in time, and everything in this life has solution. Maybe the death not, but we are gonna fight with that. Um, I think you have different treatments. You have different options, and we are gonna start with the less invasive. At the first, you are gonna feel a pretty bad with the chemotherapy, but with the time, you're gonna feel better because we are fighting with something wrong that is in you, and we have to win that. Um, if it doesn't result, maybe we have to use a machine, for example, como se me fue, la radiotherapy, and it is more localized. And maybe at the first equal, you are gonna feel maybe not so good, but with the time, you're gonna get better. We have to keep in mind that maybe the cancer, we're gonna try uh, to mejorar, to try to get better you or mejorar tu condición, try to get better your condition, but we have the possibility that the cancer stop or
Try to
maybe
get you better.
advance. Try
I'm
to get
sorry,
to
I have a
better.
little bit delay. Okay.
and and well, you have to keep the mind open to the possibilities, but I need to you still be positive because your animal,
Uh, I
how
you have to be positive and maybe cheer you up. I want you to cheer you up, like
yeah, I want to
animar,
cheer you up.
right?
Uh-huh. Because if you are sad, your body feels that, and maybe don't fight like we want to. So keep the keep your emotions up, and we are gonna fight. And I think we are gonna our best try to all are gonna be okay.
Okay. So thank you very much. Well, we're gonna talk about now. I think you have more experience here. Okay. So, what is the oldest and youngest age for giving birth that you have known in your country, maybe? And in your opinion, should assisted conception be available for anyone who wants it or not?
Okay,
The
I
first
have
one.
seen. Okay, I have seen the most youngest. I have a patient who has 11 years old.
Wow.
Yeah, that's why I told told you once time that I saw a kid with another kid. And the most oldest, I think 45 years old.
45. Okay, so I have I don't know. I was thinking about this child with 11 years old. Does she give birth natural or with cesarean?
Natural.
Wow. Ouch.
Yes, yes. It was natural. To we had to do a episiotomy to cut down the vagina, and well, after that we had to repair. But thanks God, all was good.
Oh my God, because her body wasn't prepared, I think, at that age. Okay. Ah, Okay, so let's talk about the second question. So I was telling you that, in your opinion, should assisted conception be available for anyone who wants it? And if you're not okay with that, what do you think the limits should be?
Well, as a doctor, I don't think that maybe the religion or maybe our minds have to be a exception. We have to respect what the patient think. And I
What?
think if someone comes to me and asks me for a maybe some information for conception, I give. I definitely will give because I prefer give a conception, método anticonceptivo, se me olvidó.
Conception. But assisted conception, I think in this case, it refers to help
Ah,
people,
the birth.
yeah, to
Ah,
give birth
sorry.
a new life. Okay. In this case, it refers to that. But it's okay. We had the same problem.
um, you mean that if I help to bring a child at the world in the other world?
Yeah, I maybe if a woman maybe go to your consultation and tell you that she wants to have a baby, but she she just cannot do this because I don't know, maybe she has some problems, or maybe his boyfriend or his husband. And assisted conception, it's something that maybe now it's just for people who has a lot of money, you know, like,
Well,
I don't know, mm, in vitro, no,
uh-huh.
something like that, right? I don't know if it should be for anyone who wants it, in your opinion, or it has to have limits. What?
Ah, like in vitro, you're
Yeah, yeah, because not all of women can have babies, right? Just like
ah
this.
no, well, I think that has definitely have limits. Has limits because, for example, someone wants a baby and don't have money. How she gonna take the baby in good conditions?
Yeah.
So definitely, I would talk with her and tell and investigate her economic conditions, maybe a mental test to see the psychology part. I have to see the family who is gonna support her because this is not easy and she are gonna need someone. And I have to analyze a lot of things. And after that, I will decide if she's available to have a kid or not. So she's available. Well, I give a assist. But she's not. If she is not, I will try to explain why not, and maybe she has to wait to get better, to have better conditions,
Hmm.
or maybe
Okay.
she. Yes.
Yeah, I totally agree. But I don't know if in your country you have a hospital specialized in these kind of cases that can help these people to have a assisted conception, because I know that it has a really big cost. I don't know.
Yes, because the first time you don't know it if it is gonna work.
Hmm.
Maybe you have to try sometimes. But here I don't know a hospital to do that. But I know in Cuenca exists one private clinic that do that.
Okay, yeah, I know that here uh, there is some a clinic that it's called Embryo Beat, and
Yeah.
helps people to with these cases. But I don't know if they do this just for free, or I don't know. But as I I know, it was expensive. Okay,
Yes.
okay, thank you very much. So let's talk about another topic. Okay. What about with COVID patients in this time right now? Okay, what should be the management?
Well, the management is not definitely yet. We don't have like definitely treatment. It only is empiric. I don't know.
Okay, continue. I will tell you.
The most research or investigated cases has been in hospitals. So I think in hospitals we are using an antiviral treatment.
Antiviral, yeah.
Antiviral. For example, remdesivir. That's
Mm-hmm.
the more used now. We use the dexamethasone.
Mm-hmm. I
Something
heard.
more. Um,
I don't know, but some people were taking antiparasite.
that was crazy. No,
Yeah, but here everyone and dioxide of chlorate. Uh,
this is another crazy thing.
yeah, I know, but there are so many people that was taken, right? And the correct word should be empirical.
Empirical treatment, yes.
Okay,
Um, I think this is the useful. We have to put some oxygen,
oxygen, oxygen.
oxygen, okay, and anticoagulant.
Yeah, I heard about that.
Yeah. Now I have seen some articles that are studying the vitamina,
Vitamins.
vitamin D and E.
Hmm.
So some people are taking that. It's not definitely bad. Some investigations say that maybe it could help.
Okay.
Mhm.
Okay, that's pretty good. Thank you very much, Liz. I will send to you my questionnaire, please. Oh,
Okay. Yeah, I see.
okay.
Okay, done, teacher.
I will take a picture and okay, thank you very much. See you tomorrow, Liz.
Thank you. See you tomorrow,
Bye.
teacher. Bye, Salome.
I leave.
Hi, Salome.
Good
Good
afternoon,
afternoon.
teacher.
How is everything? Is it raining there?
Yes, really raining hard.
Yeah, here too. And Liz told me that there it was raining too, and Carla told me that it was raining in Cochabamba too.
Really raining really
Yeah,
hard.
yeah. Okay. The word is so crazy.
Yes.
Okay, let's talk about the topics we learned yesterday. Okay, I will put you in a situation. I know you're a nurse, but I know for sure that you can manage or you help a doctor for this kind of management. Okay, imagine you have a patient with cancer. How would you explain his condition to him?
Okay. That is the same question that you asked me the last class. You remember
Yeah,
how I said, for give a diagnostic, I can do that because I'm a nurse. It's not because for the profession. It's because if I say something wrong, that is, I
it's
mean,
not
something that,
ethical.
sorry?
It's not ethical.
Could be, but it's more for the patient that it don't understand well the situation or well the pathology. And if the patient or the familiar patient asks me about that, and I say something like maybe could more help, I mean more how do you say esperanza? I
Hopeful.
helpful. I say helpful. Okay, some helpful.
maybe they will be a hopeful person, but if something happens and it is bad, the familiars will tell, no, the nurse tell me that
Yeah.
is something that pass in some experience for years ago. So for that, the nurse can be do the give the diagnostic. Yeah. For other way, for when the the doctor, medical team, or the familiars tell the patient what is her conditions, I can do this thing. I can firstly talk with him and try to explain it, because sometimes the doctor, for be very busy, don't have time for maybe talk with the patient, explain step by step the what is the condition, how this evolution, and the prognostic, maybe good or bad prognostic. uh, so I can do that. Maybe how I told you that I choose on God, I I start with that part firstly, because I don't know what is the purpose of God, when they give us illness, but I am sure that is with a purpose. Maybe, or maybe with a goal. It's maybe hard, but in sometimes we the person want a life, but all the things I think is for something with a purpose in our lives. After that, uh, make all the care of the patient that I can do, as I can do all. And that is, and maybe when a patient with cancer, in the chemo or the radiotherapy, that is the most common treatment, in the cancer. So I try to this is not this to low the secondary effects low in that patient, because it's really hard to receive chemo. Sometimes I was in oncology, and the patient, I didn't administrate the medication, but I only see because I was in a observation day. That is really hard, because the arms, their bends, they are really like upset of the life, and that is really hard to see for other person. And when are younger teenager, or at the same way so older, is really hard to. But the life continue, and you try to be polite
Yeah.
with that person.
Okay. Thank you very much. Let's talk about a topic I think you have more experience in. Okay. How would what is the oldest and the youngest age for giving birth that you have known in your experience?
Okay. For our each body of woman are really different, but in concession of the for the war, I think the youngest, but recommended is like 24, 25 years. But in our reality of Latin America is like since 15 years or maybe less. I don't know, but I think 15 years the woman be pregnant, and that is really hard to know, because I try to be considerate with that patient. At the same time, I try to understand, because we don't know what is the circumstances that happen in their life for be pregnant. But I'm really upset when I saw a teenager pregnant. It's not because I discriminate that person, but I'm really upset because in the actually the sexual education is not like is free, is a free topic that we can talk. And sometimes the war, or maybe the public medicine offer you method for care about that. So for that way is like upset. And for older person, I know that is for until 42 years, but maybe we have the risk that we have a lot of complications in the childbirth, or maybe during the pregnancy. So, in conclusion, I think that is good, a good age from 27 until 35 years to be pregnant.
Okay.
Mhm.
Thank you very much. Carla was telling me that she know about someone that was 13 years old, and Liz told me that she know about someone that it was 11 years old. So
So young.
it's so crazy, right?
Mhm.
But the I know that the solution is not just talking about these topics and giving like pills, right? Like,
Mhm.
here you have, and just be responsible. We have to make it conscious to these people and their families. I think their parents just have a role on it, but I don't know where we're gonna start. So maybe if you can or have the chance to talk about or to speak or to give a little bit classes or something in the area you work with, it will be so good for them advising. Okay, so the other question would be, in your opinion, should assisted conception be available for anyone who wants it? If not, what do you think the limits should be?
About what do you mean about the assisted conception?
Assisted conception, it means here in this context that not all the women can have babies, right? So they go to different places and pay for this kind of help of, I don't know, here we have a clinic, embryo bit, and they induce have children. I don't know if you
Like
understand,
for conception?
like in vitro, something in vitro.
Yes.
Yeah,
Okay.
and continue.
Okay. So I think that is a hard topic to speak because it's two ways for me: ethical way or natural way. Like a Christian person, I know that is not correct because the God do the natural things, the woman and man, and all that kind of things. But for other way, I know that maybe I want to be a mother, but when no now, but
Yeah,
I
I know.
know that when a woman have that wish are for one way a wish, a personal wish, other for have a family, maybe is get married that person and have a couple that want to have a baby.
Yeah,
For that way I think that is like a option, a good option, but that person who do that is like they are paying to be God because they are paying to make a life. That is my ethical problem because when sometimes somebody asks me about this topic, it's like, oh my god. At the same time, it's not good because they are playing to be God, but for other way, is a wish for the other person. But I think that if we have other option that is the adoption
yeah,
because I think it's better than in vitro fecundation. But the thing of this case, the couple, the woman, the person who do that, try to pray and talk with God and say, "Okay, give me what I have to do and have a solution." Because it's really hard. I know. I think to be a sterile person, a sterile woman. I think it's very complicated about that. So we can't say no, they are doing bad because we don't know what they are feeling, and maybe feel really bad. So that is my point.
yeah. It's really hard, right?
Mhm.
So at the same time, the ladies were telling me that maybe they have to think about this woman in specific, that doesn't have money, right? That's why she wants an assisted conception for free, for example. And if she doesn't have money, how should she will take care of the children or the kid? So it's it's a very hard topic, right?
Yes.
So okay, let's talk about something else. What about now in this pandemic? What about COVID patients? What should be the management?
Okay. Now, with the notice that today told me at hospital, I will work at COVID area, but I am
Oh no.
it's like
Okay.
a commotion, but I'm okay.
I know you will do this a good job, so don't worry.
Yes. So asking your, I answer your question. In the beginning of the pandemic, was really hard about mental health. Because the person who had that were really discriminated. But now I think the isolation have to be the principal thing. Firstly, that the patient who has this have to be in her home if they are stability they have to be
Stabilized.
in the home stabilized. They have to be in the home at home, making all the advices that doctor told them, and if they need a medication, take the pills at the hours that be, all the things. But for in the hospital, I think to be like in Latin America, are not like Europe that have the each
Yeah.
room for patients. That is the best. But here, I know that is in the north part of the north floor for hospitalization of COVID, have 7 patients. It's big. It's a big room. But I say that, oh my God, 7 patients is hard. They have the protocols to have in each institution, public or private, have to make the control specialty in her rate, saturation, and respiratory frequency. That is the most important things in this case, and the temperature. How we are in the hospital, we can't make a laboratory exams, especially in blood exams. Control all the progress, the progress in the illness of this COVID. Each day will be uh, view a good progress with the patient. But when they are complicated, it's so hard because they will go to intensive health care. So that is, I think that.
Okay, I understand. Okay, which one the best way to know if a patient has COVID or not? I'm talking about the PCR
Mhm.
test or the ELISA test.
Um, Actually, yes, I'm sure that here in Ecuador, ELISA is not utilized anymore because they have a lot of false positive case that was really alert and waste a lot of pills of treatment about that. So the public ministry decided that and don't
Is
use
discarded.
discarded ELISA test for the
So PCR. Mhm.
yes PCR. That is that we use here, and special in the first level of health we do the rapid test, and when we and see something wrong or something's like is not clear, we reference for the PCR test.
Okay, the rapid test then is with the thing that introduces into your nose.
Mm, no, the rapid test is with blood.
Ah, okay.
Upload.
And the PCR is the other one.
In the noise. Like maybe under the top. No, just kidding.
Yeah.
Yes.
Okay. So I got it. Thank you very much,
Welcome.
Salome. Okay. Can you please, I will share with you my questionnaire
Done.
and I will take your picture. Okay.
You know.
Thank you so much. See you tomorrow then.
Have a good night.
You too. Bye.